getting your vaccination or vaccinating your family, now is the time. Please don't wait. Pharmacies are visited every month by families, including those families with special needs, and we are a trusted regular face for these people. For many, the thought of having to line up for hours at a vaccination hub is a daunting prospect, so their local pharmacy is the ideal location for their COVID-19 vaccine. So wherever you are in Queensland, you can visit findaPharmacy.com.au to find your local pharmacy and conveniently book in for your free COVID-19 vaccination. You can also walk in to a pharmacy on the weekends or after hours, such as the one here at Terry White Kemmart, Arana Hills. Anyone over the age of 12 years is eligible to receive their COVID-19 vaccine, the Moderna one. 97% of Queenslanders live in metro areas, live within 2.5 kilometres of a community pharmacy, and the same for 66% of our regional Queenslanders. So if you're not sure about receiving your COVID-19 vaccination, pop into your local pharmacy and talk to your pharmacist. We're more than happy to talk to you about this, and you're our #1 priority. Please don't forget, visit findaPharmacy.com.au and book in your free COVID-19 vaccination. Thank you.
Any questions? New South Wales hit over 80% yesterday. What happens when we reach 80%?
Well, as you know, we're still working through those details, but we remain committed to the national plan. What you've seen in recent days is the New South Wales government have torn up that national plan. The Prime Minister's so-called national plan is in tatters now, thanks to his buddy in New South Wales going off script, going rogue. Well, we will stick to the national plan, and we'll continue to stick to the national plan.
New South Wales, though, gave their citizens, when you reach X target, you'll get this amount of freedoms. Isn't that a way to motivate people? If we set a date for reopening, wouldn't that motivate people to get a vaccine?
Yeah, well, those targets are there. As soon as we reach those 70 and 80% targets, well, then the need for restrictions will get less. I guess the difference is we're not in lockdown here, so whereas in New South Wales they've had the motivation of lifting a lockdown, we're not currently in lockdown, and so the motivation, the incentive is to avoid a lockdown, and of course when we reach suitable thresholds, also being able to lift other restrictions. But there are very few restrictions currently in place in Queensland when compared to the southern states.
So why won't you set a date for reopening the border then to get people?
Well, because we don't know when we'll hit those targets yet. We absolutely need Queenslanders to go out and get vaccinated. We're not yet at 80% first dose, and so that makes it very hard to predict when we will get to 80% second dose. As I said, now that we're over 70% first dose, well, that gives us some confidence about when we will get to 70% second dose, but we need Queenslanders to go out now and get vaccinated so that we can anticipate when we will meet those thresholds.
Obviously, the hospitals can't cope with too many patients from COVID. 80% hasn't seemed to have been feasible. Are you really just waiting to see what happens in New South Wales experiment in order to see when you'll open the borders here?
Well, we will get the opportunity to see what will happen in New South Wales. In fact, we've already had that opportunity. So much of the input data to that modelling comes from the experiences in New South Wales and Victoria, where they have had large number of cases and where their hospitals have had to cope with large number of cases. So, of course, we will continue to use that information to inform our response here in Queensland.
But no one can really plan for Christmas, I take it then, to know whether they can see their interstate rallies?
Well, if we get vaccinated, then they can. And so that's really the message to Queenslanders. Go, get vaccinated, and that is the thing that can give us certainty about when those other changes might be possible.
So is it 70% double vax when you really starts seriously looking at the border situation?
Also, the national plan says that at 70% lockdowns are less necessary and can be more targeted, and so that is the commitment at 70%. At 80%, again, lockdowns are even more rare. So they're the commitments. We are exactly on the national plan, and we'll continue to. Yeah, well, as we've noted, the national plan was agreed to before those massive outbreaks, and so before border restrictions became just so critical to keeping the virus out of Queensland. And so we'll have more to say about when we think it's safe to adjust those, but I think what Queenslanders know is that we will continue to take the health advice as we have done throughout, and that is what New South Wales has just stopped doing. They have just abandoned the national plan, and they have just stopped listening to the health advice.
Will you give the tourism sector notice when you're going to reopen? I mean, a lot of them are raising concerns just this morning that they don't get enough time to tell people to book their holiday.
Look, I expect, as we always have, that we'll give as much notice as we possibly can. Sometimes you can't win either way. When you give people notice, they say, "Why can't we do it straight away?" So we have to manage. We have to manage that. But I guess until now, the focus on our borders has been a bit hypothetical because all of the people not able to cross our borders have been in lockdowns in their own states, and those restrictions in other states do continue to apply, and so we need to watch them very carefully and make decisions about what's the safest way, what's the best way to keep Queenslanders safe.
In terms of the vaccination rates with the borders, the Premier has indicated she'd like to see the 80% evenly spread across communities, say like Brisbane compared to say places like Cherbourg. What do you want to see before you are willing to look at the borders and when they can lift?
I think the most important thing is that every single Queenslander who's 12 years of age or older has the opportunity, the genuine opportunity to get vaccinated. And that's why we have pop-up clinics throughout the state. We have pharmacies like this one, we have GP surgeries. That's the whole point behind all that, so that we give every single Queenslander 12 years of age or older the opportunity to get vaccinated. Now, once that's happened, and that's why we've been doing things like having Bunnings this weekend, having schools, having pop-up clinics at expos. Once we've given everyone the opportunity to get vaccinated, then we can genuinely look at those different targets. As the Deputy Premier has just said, there is a national plan as to what happens at 70% double vaccinated, 80% double vaccinated, and what we need to do going forward. So we'll be looking at all of those numbers and looking at what it means. But we know that we can do a lot more once everyone's been vaccinated.
How do you know that everyone's had the opportunity? How do you even measure that though?
It's difficult, but it's by putting in place pop-up clinics. I mean, yesterday I thought we did a lot more vaccines than I thought we'd get to. It was just fantastic to have 4,111 people, and the vast majority of those first dose come forward, showed that it worked, showed that putting pop-up clinics in a very accessible location that we know a lot of people go to on the weekend actually brought people out and got them vaccinated. So we've just got to think very innovatively about where to put these places. That just having mass vaccination clinics is not good enough. We've got to have pop-up clinics where people are. So that's what we're doing at the moment, and we're working with communities. And I was always very grateful when Bunnings came forward quite early in the piece, before we had enough vaccine to be able to do it. So when we did have enough vaccine, we could go back and say, yes, now's the time to do it. So that's what we'll continue doing over the next couple of weeks. But after that, I really think people then have to have made the decision about whether or not they're getting vaccinated.
Dr. Are you confident that every Queenslander who wants a vaccine has been given access to one?
That's, as I said, that's why we're putting in place all of these pop-up clinics in very unusual places. We wouldn't normally be vaccinating people at Bunnings. I mean, we always vaccinate people in pharmacies, so that is just fantastic, having pharmacies. And we've got so many pharmacies across the state that are vaccinating. And of course, GPs always vaccinate. But we've really tried to target those people who mightn't go to different places. So really get them when they go to expos, when they go to different places, so that we can make sure that everyone's had that opportunity.
You had 2 weekdays this week that saw the vaccination rate total drop below 50,000. Is that what's starting to concern you about seeing that vaccination rate drop off?
Yes, that's why we need to do these new ways of vaccinating. and encouraging people, because I would like to see it at 50,000 each day.
So you are starting to see the vaccination rate start to
At the
drop off?
moment it's hovering, so I'd like to give it a bit of a push.
So
to
every day
increase.
you'd like to see above 50,000 by
Of
the
course
weekend?
I would, yeah. I'd really like to see us we're in the home stretch. We're genuinely in the home stretch. So we're over 70% first dose, which I'm very confident we'll get to that 70% second dose, because the vast majority of people are coming forward for their second dose who've had one dose. But now we've really got to push it so we get well beyond that 80%.
And Young, you said earlier you said it's becoming too late now for people.
It is.
What do you mean?
Because I just can't see that we can keep the virus out for much longer. We have done so well. I mean, Queenslanders have been fantastic. But it's time for us to normalise this. So at the moment, every time someone has a bit of a headache or a sniffle, I'm saying, come and get tested. We've got to move on from there. We've really got to regain our full lives again. So, and we can only do that if we're vaccinated. And it mightn't sound, 80% might sound good, but that still means 20% of our 16-year-olds and older, because that's where the measure is done, are vulnerable. And that's too many people to be vulnerable. And why be vulnerable if you've got a vaccine that can save you from getting sick?
We've seen New South Wales hit 91, 92%. Do you think Queensland will get to that mark?
I think so. I think we're pretty good at vaccinating in Queensland. Our kids, every single year, more than 95% of them get vaccinated with a really complicated vaccine schedule. I see some mums around the place here, and I don't know how you do it. The vaccination schedule for children up to age 5 is extraordinarily complicated. But mums and dads do it with their children and their GPs and get it sorted. Now, this is a really simple vaccine schedule. You need 2 doses, 3 weeks apart for Pfizer, 4 weeks apart for Moderna, and if you did have AstraZeneca, you need 12 weeks apart for that. It's not complicated. So you just have to come forward, get that first dose, and someone will talk through with you when you need the second dose. It's a really simple vaccine. I'm sure that Queenslanders can do it.
Jeanette, just want to ask you about the opposition. They're saying today that they have figures that shows there's only 6 new ICU beds since the pandemic began. Is that correct?
An ICU bed is an ICU bed when it's a physical space and it's got trained staff. And we don't put in place ICU beds that we don't need because they're extraordinarily expensive. But we can ramp them up. We've got the planning in place that overnight, if we needed to, we could double them. And that would be doubling of the bed, the space it's in, the ventilator and the trained staff. But we don't keep empty ICU beds. That is a total waste of the resources of that trained individual. So I'm very confident we can rapidly double our ICU capacity. But I don't want to do that. Who would want to go into ICU if they don't need to, if a vaccine can stop them going into ICU? So it's far, far more important than doubling and tripling our ICU capacity to just increase the vaccine. So over a year ago, when we started planning and working through how to double that ICU capacity, we didn't have a vaccine. We do now. So we should be using the vaccine, not relying on ICU.
If you're double vaccinated, then you automatically still have to go to hospital if you get COVID.
No, of course not. No. We're already moving away from that strategy. So when we had that last big outbreak with the Indooroopilly cluster, we started treating people in their home with virtual care. And that's what we'll do going forward. Of course we will, particularly people who are fully vaccinated, because it's very unlikely that they will become sick, but it will be done in a very careful manner to make sure that those people are safe.
Stephen, could we just grab you, just on the opposition claiming today that there's been little investment in ICU beds, is this just playing politics based on what Jeanette Young said?
It is. This is just the daily David Crisafulli press conference where he bags our health system. The fact is we've had plans in place to deal with a widespread outbreak for the best part of 18 months, even longer now, and it would be silly to, as the Chief Health Officer has said, have staffed beds without patients in them. Our hospitals operate at a very low level of latency because that's the most efficient way of operating them, but with a significant ramp-up capability, and that's what's in place. But it is very unlikely that somebody who is double dosed will need an ICU bed. And so while we have plans in place to create those ICU beds if we need them, it is a lot cheaper and a lot more efficient, not to mention a lot better for the individual to just get vaccinated because, as the Chief Health Officer has just said, ICU is not a very pleasant place to be. You don't want to end up in an ICU bed, and the way to avoid that is to get vaccinated. The way to avoid seeing your loved ones in an ICU bed is to encourage them to get vaccinated.
If the hospitals are ready though, then why have you accused the Morrison government of shortchanging Queensland?
Oh, they're ready, but what we will see, if there is a significant outbreak amongst unvaccinated people, we will see a surge in demand. Now, our budget adjusts to meet that demand regardless of what it is. The Morrison government has an artificial cap on their contribution. So our hospitals are funded under a partnership agreement between the state and the Commonwealth, but the Commonwealth has put in an artificial cap of 6.5% funding growth, no matter how much demand grows. And what we've seen in New South Wales and Victoria is significant increases in hospital demand that has largely displaced other less urgent care. So people waiting for elective surgery, for example, less urgent elective surgery has been suspended in New South Wales for nearly 4 months now. So that's what will happen if we have an outbreak before we've got enough people vaccinated. That's why we need people vaccinated, and we need the Prime Minister to live up to what should be a true partnership. A true partnership should see both parties meeting their fair share, and that's all we've asked for. We're not the only state to have asked for that. Every single state and territory have asked for that.
Do you have an update on the numbers of people on the home quarantine waiting list, and are you planning on adding any more slots?
I don't have any new numbers than yesterday. So yesterday we had 344 who had already arrived, and there were 998 booked in to arrive by Thursday of this week. So that's at 1,000. So at the moment we're reviewing that whole process to see where we next go with it.
Premier, last question. Sorry, Deputy Premier, last question from me.
You'll get me in trouble, Sean.
Anna will be very angry about that. Sorry, just wanted to ask you, in regards to the tourism campaign that kicks off tomorrow, are you worried about the website crashing, given that there's so much promotion to get on board and get a half-price ticket?
I don't have any briefing on the capacity of the website, but I'm sure we are well prepared for the traffic that might come, and I've got no doubt that as people can come to Queensland, we're going to be inundated with people who've had to put off their Queensland holiday for a year or two. They're all going to want to come here because all of the best places to visit in Australia are here in Queensland.
Based on that, then, I know you haven't given a date on the board, but would you like to see the board open by Christmas so that you can help out tourism operators, let alone families?
I'd love to. I'd love to see it open sooner, and that's why we're here. That's why we're talking about vaccinations, because the sooner we get people vaccinated, the sooner we can adjust those restrictions. The sooner we can welcome people back to our state, moving here or coming here as tourists.
Deputy Premier, I just have a question about there's reports about the skill shortage today in today's paper. Is there anything else the government's doing to address that issue?
Yeah, look, this is an unfortunate byproduct of what is a very good thing, and that is that our unemployment rate keeps going down. We are creating more and more jobs here in Queensland. The 4.9% unemployment rate is a great thing for Queensland, but it means increasingly employers are struggling to find the skilled staff that they need, and that's why we're investing in our people. We're investing in giving Queenslanders those skills so that our employers can then give them jobs, and so we can continue to drive that unemployment rate down. Thank you. Now we're going to give someone their needle. Not me. Someone qualified.
Have you got someone to vaccinate?
Yeah.
Wow.